This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. The treatment of male infertility obviously depends on the cause we find, and a group will be, I'm sorry, but we're not going to be able to do anything in relation to creating a baby with your genetic material, at least at this stage of the world of technology. It is possible in the future, and there's certainly been some work done in mice that show that if you take a stem cell, a primitive early stage cell, even from the skin, you may be able to convince it to turn into a sperm. No human work on that, as far as I know, has been done, but certainly in mice, they have produced sperm. I'm not sure they've ever produced offspring, but it's something for the future. So probably of the men that come with, these are the men with absolutely no sperm, more than 50% of them will probably have to say, sorry, but we can't do anything else, and really your only way to have a baby with your partner is going to be to use donor sperm. Of the other groups, if you have a low sperm count, let's start with the group that have low pituitary hormones, the ones where the foreman and the man in the brain who's telling the workers downstairs to get on and make that production line work. If his voice is very quiet, he's whispering, he's got very low levels of hormones, we can give him a kick up the bum and use medical treatment to stimulate the pituitary to produce more of those hormones and hopefully produce a normal sperm count. So the standard therapy for that, working on the brain, is using a drug called Clomiphene, which we use in females for a similar reason, to increase the FSH production, which is what is stimulating the production line to work. We use that for at least 3 months, because from the time that we start the stimulation, the production line takes 90 days to get from the basic cell through to a swimming, pregnancy-looking sperm. So it does require some patience, and does require, as I say, at least 3 months of therapy. And what we hope will happen is to increase the pituitary hormone levels, which will then stimulate the production line to produce more sperm. The alternative is to stimulate the testicles directly by giving hormones. HCG is one hormone that's used, FSH is another by injection, and those directly stimulate sperm production. But again, it's a 3 month time frame to get to a time of improvement. The next option we'll talk about is for the men with no sperm and no obvious cause, whose genetic makeup is, or even if they've got some abnormal genetic makeup, it may be indicated to actually try and find little pockets of sperm in the testicle, which requires a general anesthetic. The testicle is then opened up, or butterflying it, laying it open, and then using a microscope looking for little patches of tubules where the sperm may be. And in certain of the genetic conditions, like Clomiphene, there's about a 50% chance of finding some sperm, although the ejaculate has no sperm. And again, in some of the Y deletion issues, we can still find some sperm. The other outcome of doing the microdissection is we send the samples off to the histopathology lab, and they can tell us whether there's any chance of sperm production. So the management of those cases depends, as I said already, on the LH levels. If you've got high LH and FSH levels, we could still go and hope to find some sperm, but we're not going to be very optimistic. Finally, I've talked about the various levels of sperm reduction, mild, moderate, and severe, and that the chances of natural conception in severe is less than 1% in a year, moderate maybe 5% in a year, and the mild group may creep up to 20-25%, but that's still very low. And if we can't move those levels upwards by medical treatment, or dealing with varicocele can sometimes help, as I've already said, then there is the option of IVF with something called ICSI. So in normal fertility, what happens in the uterus, which it's in those fallopian tubes, is that something in the order of 50 to 100,000 sperm will surround an egg as it comes down the tube, and one of them will fertilize the egg. Why we need so many, no one really knows, but that's the reality. In the laboratory, when we've got normal sperm counts, we do use a similar approach. We put an egg in a dish and we put 50,000 motile sperm around it, and we'll get good fertilization rates. So one of them will pick out the egg and inseminate it. If, however, the sperm numbers are low, what was discovered it was actually 1992, the first pregnancy was reported, where one individual sperm was picked up and injected into the oocyte, into the egg, and produced a pregnancy. So that ICSI technique requires only one good sperm per egg. So if a woman in an IVF cycle on average produces 10 to 15 eggs, we only need 10 to 15 sperm, which means that men with even very severe low numbers of sperm can get pregnancy rates equivalent to men with absolutely normal sperm. So there's great hope, provided we can find some sperm. So ICSI is the technique, and we do about 55 to 60% of our cases in the IVF lab, ICSI cases. Because if there's any doubt about sperm, that's what we do. Or if in the previous cycle they've had poor fertilization, then we'll use ICSI to make sure that a sperm gets into that egg. So the end point of all of the male fertility story is that the vast majority will end up having a baby from their sperm. There's a small group with azospermia, a small group where even in azospermia we can't find any sperm in the testicle, where donor insemination is going to be the only way forward. So the world has come a long way in the male fertility world. That ICSI step is now, as I'm saying, 30 years old, and it's meaning that virtually all men with reduced sperm counts can look forward to getting a baby. Okay, so that's really a rundown of the causes of infertility, the investigations of infertility, and ultimately the treatments of infertility.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.